Morning. It is rather quiet in Dhaka. The people are hurrying to work, running errands and accomplishing other matters. The flow of life is quite fast for the city dwellers, with a population of 12 million people. The people, young and old, are racing against time in search for a living. These are the hues of life in Dhaka, Bangladesh. With a population density amongst the highest in the world, life is filled with many challenges. Work, family, children, and poverty. On average, the income per capita in Bangladesh is just 90 ringgit Malaysia a month. The population of this country is almost 194 million. 40% are women and children. At a time when children their age in other countries are playing, enjoying their childhood, and going to school, children here are forced into adulthood well before their age. Growing up in a demanding environment, children are confronted with many life challenges and problems. Among the predicaments facing these children are problems with cleft lip and palate. It is estimated that some 300,000 children in Bangladesh suffer this condition. According to medical specialists, among the leading causes of the problem are hereditary factors and poverty, resulting in a lack of essential vitamins and nutrients, especially among mothers. Aklima, a 4-year-old living in the village of Cha Islampur, Bibaria, roughly 130 kilometers from Dhaka city, is among the children who are plagued with this problem. Growing up away from the hustle and bustle of city life, Aklima wants to grow up happy like other children. But she is often marginalized by her friends. The cleft lip problem has prevented her from experiencing life like other children her age. And she is only allowed to watch other children play from afar. Aklima's father, Vutamaya, receives news from relatives and friends of the free treatment and surgery courtesy of Mercy Malaysia, USM, and the Dhaka Community Hospital, as published in the newspaper. Mercy Malaysia is a volunteer relief organization providing medical and humanitarian service locally and abroad. Bangladesh is among many countries which sought expert help from USM to perform this mission in collaboration with Mercy. With the help of the Dhaka Community Hospital, Mercy and USM expect to perform surgical treatment of cleft lip and palate for over 54 Bangladeshi children. USM has been providing this charity service since 2009. An estimated 220 children were successfully treated. The mission to help Bangladeshi children by USM experts is headed by Professor Sukari Halim, a consultant and senior plastic reconstructive surgeon from USM Hospital in Kelantan. Professor Sukari is no stranger to Bangladesh. Many have benefited from his help. Once again, Mercy Malaysia has called upon Prof. Sukari for this mission. Receiving news about the free treatment and surgery published in the local newspapers, Vutamaya wasted no time in bringing Aklima to the hospital in Dhaka. He hopes that his child will be selected for the treatment. It will change her life completely. Without a good public transport system, getting to the hospital was an ordeal. Although, in reality, he is not certain his daughter would be selected for the free treatment. At the community hospital, many people are now queuing in line, waiting for their turn to undergo a health screening. Some are also waiting for the results from the specialist, whether their child is eligible for the surgery. Many people who suffer cleft lip and palate in this country are not treated simply because they cannot afford it. This is also due to a shortage of surgeons and health practitioners. The arrival of USM mission delegates was greeted with hope by the people of Bangladesh. The delegation consists of 3 surgeons, 2 anesthetists, and 4 trained nurses. Their job is not easy. They need to ensure the patient's health, study the problems of the children in detail, and learn about the history of their patients. The journey is quite far. Finally, Aklima reaches the Dhaka Community Hospital. At the hospital, Vutamaya brings his daughter Aklima to undergo a health screening. Finally, it is Aklima's turn to be examined by Professor Sukari. The selection of patients for the surgery is done by the USM team. The idea is to choose a healthy patient that is suitable for the surgery. Vutamaya is thankful that Aklima has passed the health screening. But Aklima looks confused and dumbfounded after the check. After taking a rest at the children's ward, the nurse takes Aklima to the operation room. Soon after being anesthetized, Aklima falls unconscious. Professor Sukari checks her lips, and starts to perform the surgery. The treatment this time around is a bit complex. The size of Aklima's left and right lips are not the same. The surgery takes more than an hour. The parents who are outside the operation room are anxious. This includes Vutamaya, worried about his daughter, who is undergoing surgery. He prays the surgery will change the future of his child. In this visit, Professor Sukari is expected to do 12 surgeries, and Aklima is one of the lucky few. Like any other procedure that he has done, the surgery on Aklima runs successfully. Addressing community issues for the bottom billion ranks high among USM's apex missions. It is a reflection of the noble effort and contribution of knowledge and expertise from USM to the people of the world. This effort by USM is much appreciated by the people of Bangladesh. USM's services and contribution has helped to change the fate and lives of many sufferers of cleft lip and palate. Mercy Malaysia has also given their trust to USM and also appreciates the contributions made by the specialists.
Our Cleft missions since March 2009, and this mission would be the 5th mission in total. HUSM has joined the previous 3 missions, making it the 4th mission this time. So I think the partnership with HUSM has been wonderful, has been really good, because we share the same objectives, especially in terms of serving the most underprivileged people in Bangladesh. And I'm very glad and happy that we also have signed an MOU with USM to formalize the working relationship with the HUSM volunteers. They have helped so much in terms of making the mission a success, and we hope that this partnership will be better and can be improved in the future missions.
This is merely one of the many charitable initiatives carried out by USM to aid the bottom billion. The contributions of expertise like these are in line with USM's mission. Aklima is only one of thousands of children in Bangladesh who suffer from cleft lip and palate. There are still many more Bangladeshi citizens waiting for treatment. And USM will continue to contribute their staff, knowledge and expertise to the world.